Hi there. Um, this is the first of a series of videos entitled What Your Doctor Did Not Tell You. And this is part one of that series. And before I get started, I just want to make sure to remind you to please subscribe to this channel so you make sure you get all the information that I would like to share with you. And subscribe, like the video, share it with your friends, let everybody know, because I'm an engineer or retired engineer, and I don't want to in any way give you the idea that I don't like doctors or that I'm against them in any way, because I'm really not. I've always liked doctors, and I always will, I'm sure. And I just wanted to share some information with you that I haven't always apprised myself of, but I have recently been learning about things that I would like to help you understand as well. And it's really important for everybody's well-being that we all know these things, understand them very well. When I was young, 20s, 30s, 40s, even 50s, I never paid much attention to the health thing. In fact, I'm a person who has I've lived a very dangerous life because of that. I never paid attention to things like the ills of drinking and driving, and I drank alcohol and drove cars and lived to regret it. Fortunately, no one was injured other than myself. But because of things like that and just general ignorance, I think we can say, I've lived out, fortunate enough to have lived out maybe 15 or 20 of my 9 lives, and so I'd like to pass on some of the things that I've learned, and some of the things that you can benefit and profit from by not doing some of the mistakes that I've made. So in the beginning, when you're young, doctors who are very nice people, they're wonderful. When you're young, you bang yourself up and get scrapes and accidents, and they're really fabulous at sewing you up, patching you up, and fixing you and all that. And if you go and visit them and you ask them if you're healthy, in your 20s and 30s, they say, get out of here. I mean, you're as healthy as a horse. Well, fortunately, for some people, you stay that way most of your life. Other people aren't so fortunate. And if somebody has severe medical problems, of course, they should listen to what their doctor says. You should always listen to what the doctor says. But there's some things that I've discovered in the for-profit medical system that we have here in the United States that I wanted to share with you. And most recently, I don't have heart problems or blood pressure or diabetes or anything like that, but I have noticed that I've been seeing this doctor that I'm seeing. I've been seeing him for about 3 or 4 years, and the entire time I've been what they call pre-diabetic. In other words, approaching the level of being diabetic. And so if I didn't change my ways, change my exercise and diet and all this, then I eventually will be diabetic. So the first thing I did is I've cut out beer, which is carbs. Carbs add a lot of sugar to your diet. The starch in carbs turns to sugar, and of course sugar is what causes us to be diabetic. So that's something that I've been doing in future parts of this video, in part 2 and 3 and whatnot. I'll tell you about my results, and I'm doing cutting out the carbs, going low carb, high fat, moderate protein, kind of the keto kind of thing I'm sure you've heard of. And I'm doing the fasting as well, which I'll cover in another video. You can see my other video regarding fasting and the benefits of it and whatnot. But I've been really happy to find out what I have discovered, which is mainly that the doctors, they're putting the cholesterol and the cholesterols and the PSA, prostate specific antigen, in the spotlight, and they've been kind of ignoring the A1C, or the diabetes thing. And of course, I think the A1C is important because, like I said, I've been pre-diabetic the whole time going to the hospital. I'm older now, and so the body doesn't handle things like alcohol and starchy food as good as it used to. So it's normal probably that I'm pre-diabetic, but I don't think I have to be pre-diabetic. And I'm doing the low carb diet and doing fasting and exercise and all that. So in future videos I'll make sure and let you know what my results are. But the doctors aren't bad people, they're actually very nice people, but they go to the school that they go to and they're taught that well, cholesterol is the bad thing. And in my case, healthy as a horse in my 40s, and yet I was told, well, you got high cholesterol, you better start taking some medication. And these statins, the drug companies have sold these statins so much that they wanted to put it, they want to put the statins in the drinking water because the statins do lower cholesterol. But the statins have side effects, and I'm entirely against any drugs of any kind, really, other than maybe the little baby aspirin you take as a blood thinner, stuff like that. And I've been told for the last 30 or 40 years that, well, you got high cholesterol. And I don't think cholesterol is a problem. I think that sugar from starch is the problem. The carbs is the problem. And so that's why I put the emphasis on lowering the carbs. And I've always stayed away from sugar, straight sugar like soda pop and sweet stuff like that. Have an ice cream cone once every 6 months, whether I need one or not. But so I've always stayed away from sugar. Now I'm lowering the carbs and cutting out beer and different things like that. We'll find out what the results are in the next few weeks, in the next little while. But the doctors, they put all the emphasis on the cholesterol and for guys, the PSA, which is prostate specific antigen. And I don't buy that, never have really. I mean, I went along with it a little bit, had a biopsy, because if your PSA level, PSA is that measures the protein that the prostate puts into the blood. You want to take a look around and look up the article on the great prostate hoax, and it'll tell you all about it. The guy that invented the PSA reading, they hijacked, the medical association hijacked that from him, and they use that to diagnose a lot of people with operations that they don't really need. And I will admit that they probably have saved some lives. They've found some people who in fact do have prostate cancer, but if you check with them, you'll find out that more times than not they're very iffy. They can't tell you definitively one way or another whether you have prostate cancer or not. So that's mostly a hoax, and I think it's backed up by the fact that there's 250,000 people die every year. And the reason they die is from medical errors or mistakes, which bad diagnosis is one, having people, giving people operations that they don't even need in the first place, and telling them they have cancer when they really don't. So we need to pay attention to these things because it's a very serious kind of thing. And so in the future videos I'll be covering more on these things like the PSA, the prostate, cholesterol, and the diabetes, the A1C thing. And so in the meantime, check out my other videos. Make sure that you subscribe and like the channel and share it with your friends. And I will see you in the next video. Thank you very much.